Your shoulder questions are gonna get answered today. This month, we've been doing a different shoulder lives, talking about different things, including shoulder impingement. We've been talking about shoulder pain. We've been talking about the shoulder blade and what's happening with it and all those different things. But today we're gonna answer your most commonly asked questions that we've been getting. So, the first one that we're going to answer today, the first question we're going to answer today regarding shoulder pain is, when do I need to seek help, or when do I need to find out if somebody can help me with this? And this is a really common question that we get in general, but specifically with shoulders. As we've talked about during the past month, shoulders are a little bit more complicated than other joints in our body. We have this joint right here, the SC joint, which is where the entire hand is connected to the axial skeleton, which is your cranium and your spine and your hips and everything. So there's one joint that's connecting with all these muscles to get your hand literally moving basically everywhere in space. It's kind of a bit of a delicate system. So understandable that we have different problems that happen with the shoulder and different things that we need to do to be able to help you with your shoulder. So when do you need to get help for your shoulder pain? What I usually recommend with people is, if you've had a trauma, maybe you fell and slipped on some ice or some water, something like that, and you fell on that shoulder, or maybe you were throwing a ball for your dog and you had some shoulder pain or something like that, where you remember, my shoulder started hurting when. We call that an acute trauma. So you remember there was something I did that caused that pain. All right. After an acute trauma, we want you to kind of wait 3 to 7 days to see if it starts getting better on its own. Sometimes you just you tweak your shoulder weird and you're like, it's really sore. A couple days later, it's starting to feel better. And after a week, you've totally forgotten about it. And that happens sometimes. So there's no need to go see somebody about that. So if you have an event, an acute event, where you realize, I'm having this shoulder pain and it's because of this thing, we recommend waiting 3 to 7 days. And if it's getting better during that time, you can even wait a little bit longer than that, as long as it continues to get better. Now, what you might want to do is go ahead and pull out your cell phone or your calendar, if you still like to use a paper and pen calendar, and mark down on that day, hurt my shoulder, throwing ball for dog. And then it kind of gives you that visual reminder to check in with yourself. And I've had some patients come in and I'd say, when did this happen? When did this event happen? And they're like, it was a week ago or 2 weeks ago. Oh, wait. And as they're looking back through their calendars, they're like, oh my gosh, it happened a month ago. That's what we don't want to see happen. We don't want to see you waiting a month to get help if you're still in pain, right? So that's why you document that initial event, and then any changes over the next couple days. And again, what you want to see is, after 3 to 7 days, that you're feeling better. The shoulder's on the mend. You're getting your movement back. You're getting back to your activities, your exercise, all of those things. Things are feeling better. After 7 days, you may still be limited. There may be, maybe you can't do jumping jacks, maybe you can't throw a ball, but you can reach in and get the milk, you can wash your hair, you can put it up in a ponytail, whatever it is you need to be able to do, you're able to start getting back to those things after 7 days. We're not concerned at all about people who continue to heal beyond 7 days, as long as that initial healing has already started. The people we do get concerned about, and that we definitely want to see in the clinic, is after 7 days, things are not better, things are only worse. Okay? If things are getting worse after 7 days, then we definitely want to have you come in, because we want to get to this problem before it cascades any further, before it goes beyond that shoulder and can start affecting the neck and the back and the low back and all of those things, which I promise you I actually have seen. So if after 7 days you feel like this is getting worse, the things I'm doing, I can do less things, than I could a week ago. My symptoms are not getting better. My pain is increasing. Maybe it starts to affect your sleep, or it's still affecting your sleep. That's when we want to have you come in and get a visit in, and let's figure out what's going on with that shoulder and what you need to be able to do to heal that. Okay? So that's why it's really important to write down that initial date of what happened with that acute event, because it helps you be able to track that. We tend to get busy with our lives and we forget exactly when that happened. So that's why I recommend you write down when that initial event was, because it helps you just be able to track it and be like, oh gosh, this has been 2 weeks and now I can't go to the gym anymore. So this is really a problem and I need to get some help. All right. So write down the initial event, wait 3 to 7 days. If things are not on the mend by 7 days, you're at least headed in the right direction. Things are feeling better, then definitely come on in. Let's get you an evaluation and let's figure out what's going on with your shoulder. Now, if you have more of a chronic shoulder pain, and this is a lot of our patients who come in and they're like, I don't know what I did. Like it just started hurting one day. I still want you to write down the first day you notice that you have shoulder pain and when it is that you notice it. So maybe you're like, yeah, one day I just went to pick up my coffee and all of a sudden like my shoulder was just hurting and I don't remember doing anything. So I want you to write down that first day. And then I want you to take notes for the next 7 days of how that shoulder feels. Often what we find when people don't have that acute traumatic event, but it just kind of seems to come out of nowhere, what we find is that it tends to progress. Those symptoms don't tend to go away on their own, and they tend to get worse over time. So whereas maybe you couldn't pick up your coffee cup, that was the first thing that you noticed with it, it could progress to the fact that it's actually bothering you while you're sleeping or you're not able to exercise anymore. You're having difficulty when you're at the computer all day, things like that. It tends to get more progressive when there's not that initial event that actually caused the symptoms. So that's why I would like you to document every single day, again, in your phone, on your calendar, or you can, write it down if you have if you like to use a paper and pen, that's absolutely fine too. But that way you can kind of keep track of how things are going during that week. Now, if during the week things are getting better and you're like, okay, it's feeling less painful, it's not bothering me as much, I can do more things. Again, as long as you're on the right track and things are getting better after 7 days, then you're probably fine. Give it another week, it'll probably clear up on its own. But in cases where it's more of a kind of, I don't know what started it, it tends to progress during those first 7 days. And we definitely want to get you in at that point before it progresses any further. The further it progresses, the longer it takes us to heal, right? The farther down that road we go, the longer it takes us to get back. And so we definitely want to see you come in within the first week or two of that initial event, or that initial noticing, I guess, of the pain, so that we can get on it as quickly as possible. That will help you to heal as quickly as possible. So I had a patient come in recently and her shoulder was bothering her and she didn't have an event that she remembered, and it kind of like it got worse for a couple weeks, and then she tried to stretch it and exercise it and all that stuff, and then it seemed to get better, and then it came back a month later and it got worse that time than it had the first, and then she stretched it and she iced it and it seemed to get better. And it was on the third time that it started getting worse to the point that she couldn't exercise anymore. And that's when she decided to come in and get an evaluation. Well, by that point, the problem had been going on for about 6 months, and it just is taking longer to heal than if we had seen her after the initial event, because all the muscles had tightened up, the rib cage was tightened up at that point, the AC joint wasn't moving, the SC joint wasn't moving, and so everything, her body had just kind of said, well, if that shoulder's going to be in pain, I'm going to try to hold it on and make sure it doesn't get painful. And so that's what we had to kind of undo, as well as deal with the initial injury that was causing her pain in the first place. So the longer that we go without treatment, the longer the treatment ends up taking, because we have to kind of undo all the compensation that your body has done to try to protect you from the pain. So that's why we say, if after 7 days you're not on the track to healing already, then come on in, let's do an evaluation, let's get you started with treatment, because then it will take much less time to get you out of that situation than if we wait a couple months. The longer we wait, the longer it takes to kind of come back out of that situation and get that total healing that you're looking for. So I hope that's helpful. I hope now you have some tips and ideas on how and when to seek out treatment. Basically, give it 7 days, 3 to 7 days. Keep a documentation though to make sure that you're on the right track. As long as you're on the right track after 7 days and healing is happening, then you're probably fine and you can, push off treatment for another week or two. But if after 7 days you're not headed in the right direction, things seem to be getting worse, you're more limited in your activities, it's bothering you when you're sleeping, then definitely let's get you in here. Let's do an evaluation and let's get you headed on the right track just before your body starts coming up with those compensation patterns that we end up having to undo in treatment, because that takes way longer and it tends to be way more painful, right? So let's get you out of pain just as quickly as possible, and really importantly, get you back to doing the things that you want to do. If that's throwing your ball for your dog, if that's swimming, if that's exercising, whatever it is you want to do, let's get you back to doing that just as quickly as possible. All right, if you have any questions for us or you want to talk to us about your body, feel free to give us a call for a free body chat. The phone number is 425-658-4944, and we would be happy to talk to you about your shoulder and give you some advice specifically for you. All right, I hope you guys have a great one. Hope you have a great weekend. We will be back next month with a new topic. Have a good one, guys. Bye.